I'm going to be concentrating on the clinical aspect of things and responding to the questions that have been set from the survey. And it's largely related to seizures. What are seizures? What are the causes of seizures? What are the treatments? But I also wanted to include some of the forward-thinking and forward-looking things that are being developed that can help with clinical management. So these are some of the questions that are often asked in clinical practice, and that is borne out by the survey. What is epilepsy? What is a seizure? And there are different ways that you could say what is a seizure, which I'll come to. What types of seizures? What are they called? What are their names? And what are different types of epilepsy are there? How do you confirm the diagnosis of epilepsy? And what is the cause? In this situation, we know that we're specifically about EEF1A2, but we know that genetic causes are increasingly being recognized as causes for epilepsy. And so if there is one test that I would suggest, aside from the MRI, would be genetic testing. Obviously, best treatment is a very hot topic, and Kathy has touched a little bit on that regarding gene therapy and the whole debate about anti-seizure medication rather than anti-condition treatment. So do we actually treat symptoms, i.e. the seizures, or do we actually treat the underlying condition itself? And what does the future hold? So what is epilepsy? So normally when we think of epilepsy, we think of two unprovoked seizures occurring at least 24 hours apart. So if we have multiple seizures all occurring in the same day, then we would still only count that as one. We see a pattern evolving when you have repeated seizures, as that predisposition to having seizures is what really is the diagnostic criteria for epilepsy. So even if you have one single unprovoked seizure and you have a high risk of having another seizure, then we would say that you have an epilepsy diagnosis. And if you have a specific epilepsy syndrome, there are more than 40 types, in which we can look at the way that a seizure looks, look at the clinical characteristics, and look at the EEG. We can start to put together a sort of story. So for example, we had someone who had early onset epilepsy, myoclonic seizures within the first 4 months. And we did genetic testing and we saw EEF1A2, then we would say that person is most likely would have a EEF1A2 syndrome. And it is that excessive and abnormal brain electrical activity which causes the seizures. And we can say that the seizures can be described as focal, meaning that it starts on one side of the brain and tends to remain concentrated on one side of the brain, or it can be generalized, occurring across the brain at all at the same time. And the features will depend on the affected brain region. You might hear from my accent that I'm Jamaican, and you can see an example here of Usain Bolt in his typical pose. But sometimes you can see that pose is a characteristic pose that you can get in a frontal lobe epilepsy as well. If it is seizures arising from the back of the brain, that's the area which is responsible for visual interpretation. And so if you have seizures arising from the brain at the back, towards the back, then the seizure type manifestation may be primarily that of visual symptoms. And it's important to note here that, you know, not everything that moves is a seizure, and these are just some examples here of three different types of children, and they all have movement abnormalities here, and actually only one of them is actually a true epileptic seizure. So not every abnormal movements can be a seizure, and so it's very important to know the story, know the history behind it, and actually having a video of it, it is extremely helpful. So video examples of seizure types, I thought I would show 4 different types. Myoclonic seizures. I'm aware that, you know, there will be people in this conference whose children who've already have epilepsy, and there are others who their children don't have any seizures at all. And so getting an indication of what those might look like would be very helpful. Most of the onset of seizures tend to be myoclonic in nature, and this is a website, epilepsydiagnosis.org. It's courtesy of the International League Against Epilepsy, which is a leading organization against epilepsy worldwide. So if I click on each one of these, it will take us to a video link on this website, and you can also go onto that website and access it yourself. You need a registration, which is free, but you can see all the different types of seizures there as well. So I'll show that again. It just is at 3 seconds, and it's a sudden jerk that you see, primarily in the trunk and in the hands. Okay, and so that was a myoclonic seizure. Let's see if I can find the other one. This is an atonic seizure. So you can see the sudden head flexion and head nod that you'll see there. Right towards the end, one more time. Okay, so that's an atonic seizure or a head drop. And this one is a combination of a clonic and tonic-clonic seizure. So you'll see different phases of it. A clonic seizure will be the shaking episodes, and then the tonic phase. The tonic phase of that will be where the person looks as if they're very tense. And then a clonic period is when you start to see the shaking again. So initial start of a clonic phase, then start to emerge in a tonic phase, almost as if they're locked into position. And then we start seeing the clonic phase again, which is high frequency, low amplitude. Right, and I think I'll stop there, and I'm sorry if that it was very distressing, but it was requested, and looking at this website, you can see a number of different types as well. So suffice it to say that it's very difficult to sometimes to know exactly what's a seizure, especially if you have a movement disorder. So if there's one thing that I would say as well that helps us a lot is to take a video. So taking a video is remarkably helpful. And we have the system here in the UK, which is called vCreate Neuro. In this system, what we have is a cloud-based video system in which parents can upload or carers can upload the videos onto the cloud. Then the physicians can access that. It becomes a link through their medical records that we can access it, and we can see all the videos in real time, and then we can get information about what were the circumstances surrounding the episode and what happened after the episode. And through that, we can, in a very short space of time, get some indication of whether this is a true seizure or not, and get some feedback. So for those we're hoping that this is going to be rolled out more internationally, but for right now, it's currently being done in the UK. And in addition to the videos, we've started looking at artificial intelligence to see if we can apply that so that it can be used in other places, such as in low middle income countries as well. So we spoke about the seizure types, how they look, but also how they start and where they are in the body. So they could have a focal onset, or it could be a more generalized onset. And within that, we want to know what are the potential causes. So is it structural in nature? Is it genetic? Could it be infectious in nature or metabolic in nature? And from this, we can put together the epilepsy type based on the seizure type. So if it's just focal seizures, then we will say that's a focal epilepsy. If it's generalized onset, then we say that it's a generalized epilepsy. But some people can have a combination of different types of seizures as well. And sometimes we don't know how the seizures start based on the history, or we haven't had an EEG yet. And so we don't know exactly what's the epilepsy type. Sometimes putting all this together, we can formulate exactly what's an epilepsy syndrome, and that way we can get a better prognosis and indication as to what's the likely outcomes. And related to that, we can talk about the additional problems aside from the seizures. So we're very interested and very keen to have a holistic approach and make sure we look at cognitive, behavioral, gastrointestinal, and sleep problems as well. So, this is the latest classification that is used. So we talk about focal seizures or generalized seizures. And within that, we talk about motor seizures, which you can see actual movement and or not. And if there is loss of awareness or there is preservation of awareness. So these are terms I think that some of you might be familiar with. We no longer tend to use this in the medical aspect, but we know what they mean. And so people talk about complex partial seizures, simple partial seizures. So a simple partial seizure in the new currency would be a focal seizure in which there is consciousness is preserved. And a partial seizure is a focal seizure, and so on. And if you are speaking with much older people, they might refer to as petit mal seizures or grand mal seizures, referring to tonic-clonic seizures in the case of grand mal seizures. So we talk about epilepsy syndromes, we can talk about age of onset, and you will hear this particular term used a lot, developmental and epileptic encephalopathy. And arguably, EEF1A2 is a developmental and epileptic encephalopathy in which the underlying etiology, in this case, EEF1A2 mutations, plus the epilepsy activity itself, contribute to the developmental problem. So the better you can control the seizures, then the better the outlook would be. But even when you control the seizures, there will still be an underlying problem, because the developmental etiology contributes to the actual impairment itself. We've done how we make diagnosis, a combination of the history, physical examination, and we do some tests, but largely the history it is the most important thing. So a video and knowing what happens before and what happens afterwards is crucial. And in terms of tests, the main test that we tend to do to try to make the diagnosis is an EEG. As I mentioned before, a video is incredibly helpful. So in terms of EEG going forward, so how we normally examine an EEG is that we have people like myself or neurophysiologists who are experienced in looking at EEGs. And then when we look at EEGs, there are particular patterns that we look for in order to try to make that diagnosis or not. And sometimes there are different types of EEGs. Sometimes in a standard EEG, which is 30 minutes long, sometimes we don't see a seizure during those, and the EEG looks completely normal. But that doesn't rule it out. So the ideal thing is to try to capture an event and to see if there are electrical changes as you go along as well. Needless to say, that's quite labor intensive. So there have now been AI and machine learning tools in order to try to say if EEG is diagnostic or not. And this is just an example of a prospective study that is going on to look at that as well. Some children who have epilepsy have behavioral problems, including autism, and so it might be very difficult to have lots of leads on as well. So we've been looking at whether we can reduce the number of leads, and we are having some very promising data looking at just 4 electrode placements that can help with that diagnosis as well. What about treatments? Well, there is a long list of medications that can be used, and this is very UK-centric. It's in the National Institute of Clinical Excellence and Scottish Intercollegiate guidelines. And it's really based on the seizure type. So we tend to choose medication based on the seizure type, whether it tends to be more generalized or focal in terms of its onset, and also what they look like. Are they tonic-clonic? Are they myoclonic in nature at all? So you can see there's actually quite a bit of overlap between the medications that are recommended for generalized seizures and focal seizures. So what's probably more important are the medications that are not to be used for a particular condition. In the case of EEF1A2, regrettably, we don't yet have a very specific set of medications that work extremely well for EEF1A2. So there are other syndromes in which we seem to have a better understanding. And so, for example, in Dravet syndrome, which is developmental and epileptic encephalopathy, it's one of the severe early onset epilepsies. We know that there are some drugs that are much more effective in those compared to others. Lots of the medications have multiple different mechanisms or purported mechanisms of action. So you see, for example, in topiramate here, you see it's a number of different ways. So I think all of these approaches are really treating the seizures, and they're anti-seizure medications rather than anti-epileptic medications. And I think there is a real need for anti-epileptic medications and precision medication just to address the specific abnormalities. And you would have heard a lot of the stuff that Kathy and her group are doing in order to address that. Kathy touched a bit on gene therapies, and she's got this award to look at the ASO therapy, looking at that. There's some really promising results from that in the Dravet syndromes in terms of repurpose. It's not repurposing as such, but it's traveling down a path which is already being laid, and we've seen that being laid for Dravet syndrome, and really promising results regarding that as well. So what about the future? Some people have been asking, are there particular patterns that one can predict? So some people ask about during puberty, does that make a difference? During particular menstrual cycles, does that also make a difference? So another tip is to use a seizure diary. So if you can use this app, which is called the SEER app, which is freely downloadable. And within that SEER app, you can annotate and record the seizures, but you can also record other things such as mood, sleep pattern, and things like that as well. And this is some nice work which was done by Carolee here. And what they did is that they used the SEER app, and they had self-reported seizure types. And from this, over a period of time, they were able to adapt and see what the patterns were like for individuals. And from this, they were able to estimate a seizure likelihood. So you get some idea, am I going to have a bad seizure day, or am I going to have a good seizure day? So it's a bit like weather forecasting, but specifically for seizures. And with this, you can make alternative or make necessary preparations in order to try to minimize your risk. This is some work by Andrea Biondi, again, seizure forecasting, and this is using the SEER app as well as Fitbit. And so they're able to look at heart rate, look at sleep, look at stress patterns, and looking at mood, and they were able to get an idea of the risk for individuals. So what you'll see here is that these marks here are specifically related, the red marks are specifically related to seizures, and they could see and predict for some individuals that they could predict when a seizure was going to occur based on previous history according to their heart, combining their heart rate characteristics, sleep characteristics, and stress characteristics as well. So I'll just end there. We don't yet have a specific treatment. A number of different treatments work. Levetiracetam and valproate and clobazam are typically some of the more commonly used medications because the initial presentation is myoclonic seizures. But I'm afraid we don't yet have a golden bullet, and but a lot of people are working very hard at that. Thank you very much.